It's day 6 of Interstitial Cystitis Awareness Month, and today we're going to talk about the treatment for Hunner's lesions. If you're new here, my name is Callie. I'm a registered dietitian specializing in IC, and I also have IC. If you're not familiar with Hunner's lesions, go to my previous video. I discussed what Hunner's lesions are and how they are found in the bladder. The first treatment option for Hunner's lesions is fulguration and laser therapy. So fulguration uses heat to burn the Hunner's lesion, and the laser therapy uses an electric current to destroy local nerves and decrease the substances that trigger inflammation and irritation on that bladder wall. A study found that 90% of patients who had fulguration and laser therapy reported at least a 50% improvement in their symptoms for at least a few months. Some downsides or risks due to these procedures are that the lesions can recur after a few months, resulting in pain, and the fulguration can cause scarring of the bladder wall, which can decrease bladder capacity. The next treatment option for people with Hunner's lesions is triamcinolone injection. So these are injections that go straight into the Hunner's lesions, and the great part about this is they don't leave scarring like the fulguration does and are usually tried before that fulguration procedure. Another treatment option for Hunner's lesions is hyperbaric oxygen therapy or decompression therapy. You might know this from scuba divers, whatever. This is where a patient is placed in a pressurized chamber where they breathe 100% oxygen for a certain period of time. This allows the lungs to absorb more oxygen than normal, and that helps the bloodstream deliver more oxygen to the body, where it can help fight infections, stimulate growth factors, and enhance healing in the body. On rare occasion, removal of the lesions from the bladder wall is an option, but it is a major surgery that can leave a smaller, less flexible bladder wall, and for this reason, the American Urological Association does not actually recommend this option. These are the treatment options that are available for people with Hunner's lesions, and just to remind you, the AUA recommends getting these lesions treated as soon as possible because these patients are going to be in a lot of pain. They're going to be very diet sensitive. So in order to jumpstart that healing process, they're going to need to be taken care of. On day 6 of this series, I'm going to talk about what happens if your bladder looks completely normal on a cystoscopy.